All right, sure.
Hey, friends, welcome back. It's Mike here with Metabolic Health Summit. We're here with Dr. Eric Kossoff, and we're going to talk a little bit more about epilepsy and the ketogenic diet. So you gave an amazing presentation this morning.
Thank you.
One thing that I remember just that came out of your mouth was that the rapid onset that the ketogenic diet works is 4 to 5 days, whereas some drugs for the treatment of epilepsy can take weeks until they're effective. Can you talk about maybe mechanistically why that is for some kids?
Yeah, we know that's true for some of the therapies we take care of. Some therapies will work within a few days. Some therapies will take a few weeks to titrate up their effect. For many years, decades even, we've known the ketogenic diet for epilepsy tends to work very quickly. And so when studies have been done looking at seizure calendars, it's usually about 2 weeks, but sometimes even 6 or 7 days on average, you'll see the seizures decrease, which is, it's helpful information when we talk to parents because we know it's hard for the child to do. And so we don't tell them you have to stay on this for 6 months if it's not working. We know it's going to work pretty... Okay. So yeah, it'll work pretty quickly.
So do you think that rapid onset and that change in symptomology really kind of cranks up the compliance? Because I know there's probably a lot of dietary change.
Yeah, no, I think it makes a big difference because I think, we know it's tough for families to do, and if they see an immediate benefit, it's sort of self-fulfilling. They're willing to stick it out. They'll say, yeah, we're having a really tough time here, Dr. Kossoff. However, we're seeing the seizures decrease, and they'll stick with it. So I think it's a big bonus to the ketogenic diet, knowing how hard it can be. The fact that it responds very quickly helps us keep people pretty motivated.
Now, I'm sure patients that seek you out are, more selective, and they know that you have an influence and background in ketogenic therapies and things like that. So your patient population might be different, but for someone that's new, families might be thinking, okay, my child has seizures. I'm sure diets are important, but can't we just try the medicine? How do you navigate that conversation? Because obviously the diet can really change symptoms. And some people are they sold on this? Would they rather?
I don't necessarily recommend the diet over medications. So for most of our epilepsies, the medications work very well. I think where the field is changing is saying don't try all 26 drugs. So if, the first drug doesn't work, give maybe another drug a try, but then very quickly think about dietary therapy. But we have no evidence that the diet is better than drugs. At least, not in 2020. Right. That may change as more people are doing trials. But really, to date, none of the trials have ever really looked at new onset epilepsies. We do now see, I think, because of the keto craze, a lot of families doing it on their own. They're diagnosed with epilepsy, their neurologist recommends a medication. They, for whatever reason, there may be various reasons, don't want to do that medication, and they'll read about the diet and start doing it on their own, which we don't recommend doing. However, once in a while, they do come see us, and they're like, we think we're doing well, we think it's helping, can you help us? And we usually do. And so a lot of us, especially on the adult side of our diet center, we're seeing these patients coming in doing it on their own and having sometimes good responses. They just need guidance and help from a dietitian and a neurologist. But that's, we'll see. The fad has sort of made that kind of an unusual reality for all of us.
But it's very fascinating. And, one thing that comes to mind, and we'll scoot a little bit more into the frame if you don't mind, Dr. Kossoff, one thing that I've read in the research, and I would love to get your opinion on this, is some children can do just the ketogenic diet for maybe 4 to 6 months if they're symptomatic and have seizures, and then they're almost in remission for a while. There's some sort of plasticity induced?
Isn't it? Yeah. So, traditionally we use the diet for 2 years. Interesting studies out of France and a few other sites will say, maybe, that's a tradition for drugs. 2 years is a drug thing. Maybe we don't need to be doing it that long for the diet. The diet fixes the underlying issue. If that's what's causing their epilepsy, kind of shocks their systems, the epilepsy stops, and they don't need to be on the diet for much longer than maybe 4 to 6 months. It's a hard sell because the family is like, we don't want to stop, but things are going really well. We tell them to do it, they come back 6 months later, they're still on it, they didn't listen to us. On the adult side of things, they usually don't do that, because adult onset or adult sort of affected epilepsy doesn't usually spontaneously resolve. If you have epilepsy and you're in your 20s, it's not just going to go away.
So it's almost
it does.
Those grooves, those neurological grooves are pretty much entrained, but maybe in developmental states in kids, it might be different.
Exactly. Yeah. So I have the luxury of taking care of kids that sometimes just get better. And again, to your question, maybe don't need to be on diets for years and years. Maybe only a few months, maybe enough to metabolically improve their epilepsy enough that they'll do well and can come off it. Yeah, and they do better, obviously, if you don't need to be on it, less side effects, less risk. So, yeah.
Very fascinating. One thing that I found, and parents, I would love to know your opinion on this, is children that eat generally a lower carb diet, more good healthy fats, proteins, things like that, their mood is more stable. Have you seen this in kids that are on the ketogenic diet?
Yeah, and that's actually another fun sort of developing topic, is sort of the effects of ketogenic diets on behavior. And there's been signals in some of our epilepsy studies when you query the quality of life and cognition behavior that the epilepsy gets better, but so do all of these other factors. Very difficult, as you'd imagine, to say that is from the diet, because their epilepsy is getting better. They're on less medication sometimes. There's other factors that may be playing a role. It may not be the diet as to why their behavior is better, maybe because you got rid of their phenobarbital. So there's been a very nice study out of the Netherlands that tried to tease that out by being very clear and not changing all the other parameters, and showed some improvement in behavior, not cognition, but behavior seemed to be better independently of seizure control and other factors. So we'll see. I mean, there's more studies that probably need to be done to look at that, to see if that comorbidity of epilepsy gets better too.
Very fascinating stuff. Dr. Eric, thanks so much for coming on. Appreciate you being here.
Thank you for inviting me.
My pleasure. Thanks for tuning in, friends. Hope you enjoyed this video. Please share this with a friend or family member that may benefit. We'll catch you on a future live.